Hi, today I will discuss femoral triangle. Femoral triangle is a triangular depressions in the front of upper one third of the thigh, just below the inguinal ligament. Now I discuss the boundary of femoral triangle. Femoral triangles, the base is made by the inguinal ligament. Lateral boundary made by medial border of sartorius muscles, and medial boundary made by the medial border of adductor longus muscles. Apex, lateral and medial boundary mid or cross point. This is the inguinal ligament, this is the sartorius muscles, this is the adductor longus muscles. This is apex, this is base, this is lateral boundary, and this is medial boundary. Now I discuss roof of femoral triangle. Roof made by the skin, superficial fascia, and deep fascia. Superficial fascia content is superficial inguinal lymph node, femoral branch of the genitofemoral nerve, ilioinguinal nerve, great saphenous nerve, superficial branch of femoral artery. Now I will discuss the floor of the femoral triangle. Floor made by the two group of muscles, medial and lateral. Medial group of muscles, the adductor longus muscles and pectineus muscles, and lateral group of muscles, the psoas major muscles and iliacus muscles. Now I will discuss the content of femoral triangle. Femoral triangle content: femoral artery. No, this is the femoral artery, and femoral vein. Femoral artery is from the femoral artery traverses the triangle from the base of the mid-inguinal point to apex. It gives 3 superficial branches and 3 deep branches. In the femoral triangle, femoral vein and its tributary. Femoral vein is medial to the femoral artery. Femoral vein is medial to the femoral artery. It receives great saphenous vein, the circumflex vein, and vein correspond to the arterial branches. Femoral sheath enclose the upper 4 cm of femoral vessels. Now, this is the femoral sheath. This is the femoral sheath that enclose the upper 4 cm of femoral vessels. Femoral vessels mean femoral vein or femoral artery. Femoral nerve is outside the femoral sheath. Now I will discuss deep inguinal lymph node. Deep inguinal lymph node situated at the deep to the deep fascia and medial to upper part of the femoral vein. It receives the lymphatic from the superficial inguinal lymph node. Deep lymphatics of lower limbs and glans penis in male and clitoris in females. Now I will discuss the nerve of inside the femoral triangle. The main nerve is femoral nerve. That's root value is L2, 3, and 4. Lie lateral to the femoral artery and outside the femoral sheath. Femoral branch of the genitofemoral nerve occupy the lateral compartment of femoral sheath along with the femoral artery. Femoral branch of genitofemoral nerve inside the femoral sheath. Deep nerve to pectineus. Nerve to pectineus arise from the femoral nerve and pass behind the femoral sheath. Pass behind femoral sheath means the pass behind the femoral artery and nerve and supply to the pectineus muscles. Lateral cutaneous nerve of the thigh. The cross of lateral angle cross lateral angle of triangle. Cross the lateral angle of triangle. This is the lateral cutaneous nerve of the thigh. Lateral cutaneous nerve, that is the cross the lateral angle of femoral triangle. No clinical significance or applied anatomy. The femoral pulse held in the mid-inguinal point. The femoral hernia is more common in female than male. Nerve block, femoral nerve block, and femoral vein access for the catheterization or central canal. access. Thank you.